If you are someone that has recently had an injury or a surgery that has affected the way you walk, then stay tuned because in today's video, I'm going to teach you 3 strategies to help ensure that you are walking correctly. Let's get started. Welcome back, guys. It's Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. Now, if you're someone that is recovering from an injury, recovering from a surgery, and you feel like your walking has not returned back to normal, maybe you're still dealing with a limp, then you came to the right place. This video is going to help clarify how you're supposed to be walking and how to walk correctly. Now, we all know that after dealing with a surgery or dealing with an injury, the importance of rebuilding strength, rebuilding your flexibility and your range of motion. But what often gets overlooked is relearning how to walk again. I hear many of my patients will say that their surgeon or maybe a friend or a family member has said, if you just walk normal again, or if you just put more time on your feet, eventually your walking is gonna go back to normal and things are gonna be just fine. And I will say that is false. There is a skill of learning how to walk again. There are strategies that we're gonna teach you in this video that will allow you to focus on good quality walking. And I'm hoping that after today's video, you feel more well-informed and you can take these strategies and implement them on your own. So let's get started with the first strategy that we're gonna teach you, and that's learning how to accept weight on that leg again. So if we're imagining as if my left leg is my injured side, often when we're dealing with recovering from a surgery or learning how to deal with an injury, we don't want to spend a lot of time on that leg. So what we'll do essentially is when we go to put weight on that leg, we naturally want to put weight towards the front of the foot. We call this the forefoot. In physical therapy, we would call this kind of like a premature forefoot contact. What we really want to get in the habit of focusing on is when we're taking a step forward with that injured leg, that we work on really stepping and initiating with the heel. We call this initial heel contact. This is our initial ability to accept the load before we start to transfer all of our weight towards that front leg. Okay, so we really want to focus on that heel contact, and that's going to help you initiate and really facilitate all the muscles of the quads, the glutes, and the hip muscles, as well as some of the hamstrings there as well. Now, we can go into depth on this specific gait cycle and all the specific medical terminology, but my goal for this video is to keep it simple so that you can understand the major stages of the gait cycle so you know how to really improve the walking. So we've talked about learning how to accept that weight with the heel, and that's going to set you up correctly so that you can learn how to transition forward as you're walking forward in this fashion, just like so. So weight acceptance is going to be key, and the way that you can practice that is when you're around your home or you're outside. When you're practicing, you should be thinking about really focusing on trying to take a step, initiating with the heel there, and then coming forward versus just kind of stepping with putting pressure more towards the front of the foot. Now, the second strategy that we're going to teach you is you being focused on learning how to take equal step lengths. Often when we're dealing with a surgery or an injury, we kind of forget about what our walking is supposed to look like, and we're so fearful of putting weight on that leg that you forget about, how much time we're supposed to be spending on each leg. So a lot of the times what will tend to happen is we spend less time on the surgery leg or the injured leg and more time on the non-surgery side, which makes sense when we're dealing with pain, when we're dealing with weakness. That's what's naturally going to happen. But when you're relearning how to walk correctly again, we want to develop awareness so that we can start to focus on really taking equal steps, which is as a result going to get us to spend equal amount of time on each foot. So if you're walking out in the community or if you're practicing walking in your home, you really want to think about those distances of your steps and ensure that when you're taking steps, each foot is stepping equally. So that's going to be extremely important so that you can get that stride to look very balanced and normal. Now, before we get into the third strategy, make sure you stick around towards the end of this video because I'm going to teach you one exercise that is going to be extremely helpful for you so that you can learn some of these strategies that we are teaching you. So the third strategy that we're going to focus on is getting you to incorporate your upper body. So you'll see if you're reading on Google how to walk or how to walk correctly, a lot of the times you'll see some blogs or articles say to use your core muscles. And quite honestly, you shouldn't have to think hard about using your core muscles when you're walking. It should naturally happen. And the way that we can get it to naturally happen and to facilitate our core is by incorporating our normal arm swing. Some of us dealing with an injury or dealing with a surgery, we initially are using assisted device. Maybe that's crutches or maybe that's walkers, and they put our arms to our side or basically fixated in front of us, and it completely takes out our normal arm swing when we're walking. If you notice people walking out on the streets or walking out in public, you'll notice that their arms are moving. When we're getting this nice facilitation of this trunk rotation, that is activating all of the core muscles and firing your obliques, your core, your breathing. It's keeping you balanced with your pelvis. But if you're someone that is using an assisted device, you find yourself really fixated with that device in front of you, and we forget about how natural the walking is supposed to be when we incorporate using our arms. So if you're someone that maybe is transitioning away from the assisted device, then you'll want to start to incorporate adding in some natural arm swing. So you might even notice that when you see some people walking without an assisted device, they might even just be walking with their hands at their side here. But really, if we're really trying to correct and improve our walking quality, we want to really focus on really swinging our arms naturally. And if we want to facilitate what we call that reciprocal gait pattern, every time I take a step with one leg, I'm actually swinging the opposite arm in front of me. So it should look more like this, more natural. So let's say, for instance, if I'm focusing on transitioning that right foot in front of me, my left arm should also be coming with me, okay? They're both kind of moving at the same time, and we call that reciprocal gait pattern. It's kind of the same pattern that we learned when we were kids and we were crawling on the ground. If you notice a baby crawling, they're using that same reciprocal pattern that we want to use as we transition on our feet and as we are walking. So we've gone over the three strategies on how to improve your walking, and I want to recap before we get into the exercise that I'm going to teach you that can really help incorporate all these techniques that we talked about today. First strategy, like we talked about, was accepting weight. Learning how to accept weight, initiating with that heel contact, and then progressing forward, okay? The second tip that we talked about is spending equal amount of time on both sides, and that includes taking equal steps when you're walking so that you can really focus on distributing that weight equally through each leg. The third tip that we talked about is learning how to incorporate an arm swing and using that reciprocal gait pattern, allowing your arms to swing at your side to get this nice rotation, this nice movement through your core muscles, and really just to start to normalize that gait pattern so you can start to walk correctly. Now let's get into the exercise that's going to help incorporate all of these strategies. So what you're going to do is you're going to be standing about shoulder width apart like so, okay? Just like when we're walking, we walk with our feet in at least shoulder width apart. We're not walking in a very straight line. So you're going to start with your feet shoulder width apart here, okay? Now, if your balance is not very good, you can do this holding on to support with one hand, either on a counter or holding on to the back of a chair, something to keep you sturdy. But what you're gonna do is, starting off with this exercise, you're gonna learn how to basically accept weight and then take weight off the leg. So you're gonna step forward with the injured or surgery side, learning how to accept weight on that leg, and then you're gonna step backward, okay? So most of my weight right now is on the non-surgery or non-injured side, and I have the affected side moving. So I'm learning how to accept weight with my heel and then really push away and come back. And also, if you notice, my steps are also equal. So I'm really focusing on taking equal steps. When you're first starting off, you might feel like it's easier to take a smaller step forward or backward, but really we're trying to get comfortable with using that weight shift and learning how to take the weight forward and backward. And then you can even start to incorporate some arm movement as well while you work on this. So now we're incorporating the weight acceptance and accepting weight on our heel. We're incorporating equal step lengths as well as incorporating some arm movements, just as though we taught you, and how important this can be for your entire walking. All right, guys, there you have it. Those are my favorite tips to help improve your walking. Now, if you're looking for more videos about how to improve your balance and your stability with walking, take a look at the video that I created here. In the meantime, if you want more information on how to build strength and longevity with your body, please consider subscribing to the channel, and I'll see you in the next one.